Understanding Addison's disease, a rare hormonal deficiency. Addison's disease, also known as adrenal insufficiency, is a rare disorder. It occurs when the adrenal glands do not produce enough hormones. These hormones are cortisol and aldosterone. Cortisol is essential for managing stress and energy levels. Aldosterone regulates blood pressure and electrolytes. Without enough of these hormones, the body cannot function properly. Addison's disease is often caused by an autoimmune disorder. This means the body's immune system mistakenly attacks the adrenal glands. Other causes include infections, genetic conditions, and certain medications. Symptoms of Addison's disease often develop gradually. They can include fatigue, muscle weakness, weight loss, and low blood pressure. Darkening of the skin, especially in areas exposed to sunlight, is another common sign. Early diagnosis and treatment are crucial for managing Addison's disease. Hormone replacement therapy is the primary treatment. It involves taking synthetic hormones to replace the ones the body is not producing. The adrenal glands are small, triangular-shaped organs. They sit on top of each kidney, one on each side. Despite their size, they play a crucial role in maintaining the body's overall health and well-being. These powerful glands produce several hormones, including cortisol and aldosterone. Cortisol, often called the stress hormone, helps the body respond to stress. It also regulates blood sugar, metabolism, and inflammation. Aldosterone controls blood pressure by regulating salt and water balance in the body. The adrenal glands are part of the endocrine system. This complex network of glands produces and releases hormones. Hormones act as chemical messengers, traveling through the bloodstream to regulate various bodily functions. When the adrenal glands don't function properly, it can disrupt this delicate hormonal balance, leading to various health problems. The adrenal glands are essential for life. Understanding their function is crucial for recognizing and addressing conditions like Addison's disease. Adrenal insufficiency, a condition where the adrenal glands don't produce enough hormones, is broadly categorized into three types: primary, secondary, and tertiary. Each type has different causes and implications. Primary adrenal insufficiency, also known as Addison's disease, is the most common type. It occurs when the adrenal glands themselves are damaged. This damage is often due to an autoimmune response where the body's immune system mistakenly attacks the adrenal glands. Secondary adrenal insufficiency occurs when the pituitary gland, a small gland located at the base of the brain, fails to produce enough adrenocorticotropic hormone, or ACTH. ACTH stimulates the adrenal glands to produce cortisol. Tertiary adrenal insufficiency is the least common type. It happens when the hypothalamus, a part of the brain that controls hormone production, doesn't release enough corticotropin-releasing hormone, or CRH. CRH, in turn, signals the pituitary gland to produce ACTH. Addison's disease, a type of primary adrenal insufficiency, arises from damage to the adrenal glands. This damage can stem from various factors, the most common being an autoimmune response. In this scenario, the body's immune system, which normally protects against foreign invaders, mistakenly attacks the adrenal glands as if they were harmful. Infections can also lead to Addison's disease. Tuberculosis, a bacterial infection that can affect various organs, can damage the adrenal glands. Similarly, fungal infections and certain viruses like HIV can also impair adrenal gland function. Genetic disorders, though less common, can also cause Addison's disease. These disorders can affect the development and function of the adrenal glands, leading to hormone deficiencies. Additionally, certain medications like those used to suppress the immune system or treat fungal infections can sometimes damage the adrenal glands as a side effect. In rare cases, Addison's disease can result from bleeding within the adrenal glands, a condition known as adrenal hemorrhage. Trauma to the abdomen, severe blood loss, and certain blood clotting disorders can increase the risk of adrenal hemorrhage.
Section 5. Recognizing the symptoms of Addison's disease. Recognizing the symptoms of Addison's disease is crucial for early diagnosis and treatment. The symptoms often develop gradually, making them easy to overlook or mistake for other conditions. One of the most common symptoms is chronic fatigue, a feeling of persistent tiredness that doesn't improve with rest. Muscle weakness is another hallmark of Addison's disease. This weakness can affect various muscle groups, making everyday activities like climbing stairs or carrying groceries difficult. Weight loss and decreased appetite are also common, often accompanied by nausea, vomiting, and abdominal pain. Skin changes are another telltale sign of Addison's disease. The skin may darken, especially in areas exposed to sunlight, such as the face, neck, and hands. This darkening, known as hyperpigmentation, is due to increased production of melanin, the pigment that gives skin its color. Low blood pressure, especially upon standing, is a common symptom. This can cause dizziness, lightheadedness, and even fainting. People with Addison's disease may also crave salty foods due to the body's loss of sodium.
Section 6. Addisonian crisis, a life-threatening complication. Addisonian crisis, also known as adrenal crisis, is a life-threatening complication of Addison's disease. It occurs when cortisol levels drop dangerously low, often triggered by stress, illness, surgery, or missed doses of medication. During an Addisonian crisis, the symptoms of Addison's disease worsen dramatically. Severe abdominal pain, often accompanied by nausea, vomiting, and diarrhea, is common. Profound weakness can make it difficult or even impossible to stand or walk. Low blood pressure, a hallmark of Addison's disease, becomes severely low during an Addisonian crisis. This can lead to shock, a life-threatening condition where the body's organs don't receive enough blood flow. Confusion, delirium, and loss of consciousness can also occur. Addisonian crisis requires immediate medical attention. Treatment typically involves intravenous injections of hydrocortisone, a synthetic form of cortisol. Electrolyte imbalances are also addressed.
Section 7. Diagnosing Addison's disease tests and procedures. Diagnosing Addison's disease involves a combination of medical history review, physical examination, and laboratory tests. A thorough medical history helps the doctor understand the patient's symptoms, family history, and any medications they are taking. The physical examination focuses on identifying any characteristic signs of Addison's disease, such as hyperpigmentation and low blood pressure. Blood tests are crucial for confirming the diagnosis. These tests measure the levels of cortisol and adrenocorticotropic hormone, or ACTH, in the blood. Low cortisol levels, coupled with high ACTH levels, suggest adrenal gland insufficiency. The ACTH stimulation test is another important diagnostic tool. This test involves measuring cortisol levels before and after an injection of synthetic ACTH. In people with Addison's disease, the adrenal glands fail to respond to the ACTH stimulation, resulting in little or no increase in cortisol levels. Imaging studies such as computed tomography or CT scans or magnetic resonance imaging (MRI) scans may be performed to visualize the adrenal glands and check for any abnormalities. These scans can help identify potential causes of adrenal gland damage such as tumors or infections.
Section 8. Treatment options, hormone replacement and lifestyle changes. Treatment for Addison's disease typically involves lifelong hormone replacement therapy to compensate for the deficient hormones. Hydrocortisone or prednisone, synthetic forms of cortisol, are prescribed to replace the cortisol that the body is not producing. These medications are usually taken orally, once or twice a day. Fludrocortisone acetate is often prescribed to replace aldosterone, a hormone that regulates salt and water balance. This medication helps maintain blood pressure and electrolyte levels. The dosage of these medications is individualized based on the severity of the hormone deficiency and the patient's response to treatment. In addition to medication, lifestyle modifications are essential for managing Addison's disease. These modifications include maintaining a balanced diet, staying hydrated, and getting enough rest. Regular exercise is encouraged, but strenuous activities should be avoided, especially during hot weather. Wearing a medical alert bracelet or necklace is crucial for individuals with Addison's disease. This bracelet should state the diagnosis and any medications being taken. In case of an emergency, this information can alert medical personnel about the need for immediate treatment.
Section 9. Living with Addison's disease. Tips for a fulfilling life. Living with Addison's disease requires ongoing management and adjustments to daily life. With proper treatment and self-care, individuals with Addison's disease can lead full and active lives. Medication adherence is crucial for maintaining hormonal balance and preventing complications.
Carrying an emergency injection kit is essential, especially during stress or illness. Communicate openly with healthcare providers about any changes in symptoms or medications.
Maintaining a healthy lifestyle is paramount, including a balanced diet, hydration, sleep, and stress management. Support groups and online communities provide valuable resources and emotional support.